thanks so much for doing this.
Hi, thanks. Thanks for having me.
You bet. Well, let's start at the very beginning. Tell us a little bit about NanoTess.
Yeah, of course. So NanoTess is a material science company, and we have a vision of preventing unnecessary suffering through nanotechnology innovations. And what we're really focused on right now is to help patients who are suffering with chronic wounds, and specifically diabetic foot ulcers. This is a condition that is really quite significant, and it results in every 20 seconds around the world, someone will actually undergo a lower limb amputation because of these wounds. So incredibly big impact on patients' lives, their quality of life as well, and then the care that has to go around them to be able to bring them back to a state of wellness. So what we're really about at NanoTess is providing products that create that real system of wellness. So not pinpointing a specific illness or symptom, but rather trying to treat wound care from a holistic care system through our products.
Cool. So what does that look like? Tell me a little bit about the product itself.
Yeah, so the product is a hydrogel wound dressing, and it contains our proprietary nanomaterials, and it's really a bit unique because it can provide both a healing support for natural healing to occur, as well as provide protection against infections. So it's a single product that really services the wound from states where it's incredibly severe or infected or even amputation stage, all the way to the point that it's achieving closure.
That's incredible. So tell me what you're seeing when you actually put this product on patients.
Yeah, we're seeing really great feedback and comments through compassionate care use. It's one of the biggest things that we've been told through feedback from patients is that it's an incredibly simple product to use that gives them the confidence that they're getting adequate care for their wound without having to undergo very significant procedures and frequent visits to certain care centers. So unfortunately, the best practice for wound care is having frequent with visits with the wound care specialists and physicians, but that's not always possible for everyone. So what this product is allowing to do is to really bridge that access point so that patients are still getting care and then able to see their physician at the most frequent time that's possible for them and where they're at in their lives.
Okay, terrific. Well, that sort of leads to my next question was, why did you want to start this company? It sounds like you really have this idea of social impact at the core.
Yeah, it's really, it's very much focused on social impact. So we realized very quickly, my co-founding team and I, that we're very fortunate in Canada to have the healthcare system that we do. The technology originates from Mexico, and they have had many compassionate care cases where patients actually couldn't afford to undergo an amputation, and that was the last resort for saving their lives. So what we really took from that is that we wanted to create a business around this concept of providing accessible products that meet the needs of patients. And that's what really brought the values-based approach that NanoTess is taking, and very patient-centered design approach, so that we're really giving patients something that is meaningful and is delivering on the outcomes that you would want to see in a wound healing journey, while at the same time not being a roadblock or an obstacle for patients to access.
Terrific. That makes sense. Some really basic questions now. So how many years have you guys been in business?
We're at 1 year. 1 year and I think a month, pretty much.
That's so exciting.
We're quite new. We're a pandemic startup. We grew up in the age of Zoom. So it's been a really great opportunity to be able to connect with a lot of individuals and not have geography be an obstacle for innovation and learning.
Absolutely. Absolutely. So how many employees do you have right now?
Yeah, we currently have a team of 8 people and growing over the next few months, hopefully.
We've talked a little bit about this, but we at Thin Air Labs talk about creating this impact all of the time, and I know you do too. But if you could sort of foresee the future, what sort of impact would you like to create?
Yeah, we actually speak about this as a co-founding team a lot. And when it comes to diabetic foot ulcers, what we envision the future is that when you're diagnosed with diabetes and you get given your insulin, you're also given a tube of the NanoTess product. And at the very least, it's a trigger for patients or people living with diabetes to ask themselves, why do I need this? And why is foot care specifically important to me now that I'm a diabetic? And just having that awareness around the problem could provide an incredible impact. And then we also feel that having the technology right there at point of care is if you get a small scrape or if you step on a belt buckle or clip a toenail wrong and this results in an ulcer, you can put the product on at a very early stage and hopefully avoid that further ulceration from even occurring.
That would be incredible, wouldn't it? So what's up next immediately for NanoTess?
Yeah, so beyond working through our regulatory approvals and all of the finalizing the requirements for getting the product commercially available in Canada and the US, and then hopefully extending to Europe and Latin America, we're really focused on building up our collaborations and partnerships within the innovation ecosystem, both from ecosystem partners as well as from other startups. So there's an incredible amount of value we can gain from others, both in our own innovation journey, but also in that focus of combining products and potentially landing on better care for patients in the end and better outcomes.
Terrific. Megan, thank you so much for this.
Thank you. Yeah, it's great talking to you.